Why suppressing that sneeze can be dangerous. Stifling a sneeze can rupture your throat, burst an eardrum, or pop a blood vessel in your brain. Researchers have warned many people when they feel a sneeze coming on, block all the exits, essentially swallowing the sneeze's explosive force. Just how dangerous this can be was illustrated when a 34-year-old man showed up at the emergency service of a hospital in Leicester, England, recently, with a swollen neck and in extreme pain. The patient described a popping sensation in his neck after he tried to halt the sneeze by pinching the nose and holding his mouth closed. Doctors detailed in a study published in the medical journal BMJ Case Reports. A CAT scan confirmed what they suspected. The force of the suppressed sneeze had ruptured and torn open the back of the throat. Admitted to hospital, the man who could barely swallow or talk was admitted to hospital, where he was tube-fed and given intravenous antibiotics until the swelling and pain subsided. He was discharged after a week. Halting sneezing via blocking the nostrils and mouth is a dangerous maneuver, and should be avoided, the doctors concluded. In rare cases, stifling a sneeze has led to a condition in which air gets trapped between the lungs, and even rupture of a cerebral aneurysm, which is a ballooning blood vessel in the brain, they explained. Meanwhile, women who started menstruating at the age of 11 or younger, or entered menopause before 47, face a higher risk of heart disease and stroke, according to a study published today. Miscarriage, stillbirth, undergoing a hysterectomy, and bearing children at a young age were also associated with elevated odds of cardiovascular problems later in life. Researchers found the additional risk varied from only a few percentage points to more than 40%, they reported in the journal Heart. Causal relationship. The findings are not the first to uncover a link between reproductive factors and cardiovascular diseases, and the data do not show a causal relationship, the authors cautioned. But their findings do strengthen the association, and suggest that women with premature reproductive cycles or a history of adverse events should be frequently screened for heart trouble and conditions leading to blood clots. The scientists drew data from a long-term health survey in Britain that monitored and tested more than 250,000 women from 2006 to 2016. The women's average age was 56 when monitoring began. More than 4 out of 5 had been pregnant, and nearly half had 2 children.